Welcome to the new Humber River Hospital, which officially opened its doors on October 18th of this year. I'm Ann Olsher, the Chief Operating Officer of the Intelligent Health Association. Our association is a vendor-neutral, technology-agnostic, global organization dedicated to educating the healthcare community on how technology is improving patient outcomes, patient safety, and operating efficiencies. We are extremely pleased to be here in North America's first fully digital hospital. Known as Lean, Green, and Digital, this 656-bed facility focuses on using the latest technology to ensure treatment is efficient and effective. Additional highlights of this new site include expanded emergency services to accommodate over 130,000 visits per year, complemented by an urgent care center at the Finch Street site that will provide care to another 30,000 visits per year. Expanded ambulatory services, including more capacity for cancer care, orthopedics, and geriatrics. Patient-centered care with 80% single patient rooms, providing amenities for family members and helping prevent the spread of infections. Modern diagnostics equipment for detailed, accurate patient diagnosis and treatment, and portals of care for easy access and less walking within the building. During today's tour, you will get a glimpse of how technology is transforming the healthcare experience for both healthcare providers as well as patients.
We begin in the central nursing station where nurses report when they first arrive on shift. Each floor is equipped with a nursing station midway down the hall and one at the end of the hallway. Upon arrival, each nurse logs into the Meditech EMR system, assigns themselves to their patients, and logs into the Ascom phone. This device and software combination is a multi-purpose tool to support internal communication and clinical productivity. The Ascom phone is used by a variety of disciplines and providers throughout the organization. In addition to its telephone features and capabilities, the system integrates with the following hospital systems using the ThoughtWire application: Nurse Call System, Integrated Bedside Terminal or IBT, and the Real-Time Locating System. The ThoughtWire Notification Manager software application receives the alerts and messages from the above devices and provides seamless communication to the end user for alerts, code alerts, and specialty alarms and subscription messages. When the nurse comes on shift, she signs into the ThoughtWire Notification Manager app on her phone and is assigned, replacing one of her colleagues who is coming off shift. Her bed patient assignments are already captured by the system, and she is ready to receive clinical notifications, nurse call events, and relevant building security notifications through the app. We are now with the team as they are doing bullet rounds. The purpose of bullet rounds is to create an efficient and effective forum for interprofessional collaboration regarding patient care while supporting planning for discharge from the time of admission.
So our patient Molly Smith, so her referrals, so we've got a CCAC in progress because we'll need to set her up for IV home antibiotics.
During bullet unit rounds, the interprofessional team updates the patient plan of care and makes recommendations. Decisions are transcribed using the unit rounds interventions. Updated patient information is displayed on the status boards located at the team stations, providing staff with succinct, accurate, and timely information. By displaying standard data elements, such as patient referrals, consults, length of stay, falls risk, discharge planning information, and more. In addition to updates made during bullet rounds, these boards automatically update when changes are made in Meditech. Electronic whiteboards were developed to replace the old grease boards at the nursing station. Their intent is to visually display pertinent information on all of the unit's patients for quick consumption by the clinicians during the bullet rounds.
It really is very helpful compared to the old grease boards that we used, because before you had to go on and any updates that had to be done, you had to actually erase it. But the electronic boards are a lot more efficient, and we're able to update the information right away in real time.
The first patient as the shift begins is Molly Brown. As I approach Molly's room, we see a room sign monitor outside of the room displaying Molly's status. Using pictograms and brief notes related to allergies, infection control, hand hygiene, and falls risks, staff and visitors are alerted to any precautions that need to be taken upon entering Molly's room. At a glance, we are able to see that Molly has a latex allergy and is also at risk for falls. You should also note that Molly's privacy is ensured, as there is no name or unique identifier on this room-side monitor. As I enter Molly's room, I am identified by my RFID-enabled badge. My presence in Molly's room is also displayed on the RTLS monitor at the central nursing station. From here, we see that Molly is already utilizing the Integrated Bedside Terminal, or IBT. This IBT is Molly's gateway to information and services designed to empower her and connect her to her healthcare team. Once in Molly's room, as a care provider, I am able to utilize the IBT to review Molly's medical record with her, update her on her results status and chart. To do this, I tap my ID badge on the back of the IBT, which launches our EMR or Meditech system. My badge has been programmed with a simple single sign-in. From here, I log into the EMR utilizing two-factor authentication.
So, Molly, we've been trying to work on your blood pressure, and we have brought it down a little bit, but it's still going up a little bit at one point during the day. So I want to adjust your medication a little bit, if that's okay with you. But we're doing well. We're getting close to our goal.
Molly also has control over her environment. The IBT is integrated to the hospital building automation system, which allows Molly to control the lights and temperature in her room. Additionally, she's able to adjust the tint level on the chromatic glass windows to reduce energy consumption. When Molly is discharged, the room settings will reset to default and housekeeping will be notified to prepare the room for the next patient. The bedside terminal also serves as Molly's entertainment center for video chatting, surfing the internet, reading, and watching TV or movies. It is time for Molly to place an order for her meals, which is also done via the IBT. Note that Molly is only able to order foods that are in line with her dietary restrictions that the clinicians have set. I am accessing Molly's chart to review her physician orders and any interventions scheduled. In this case, there is an order call for a lab draw and a new medication order. I update Molly's chart with her current vital signs using the Welsh Allen monitor, which pulls the newly obtained vitals after I review them directly into Meditech. In addition to the IBT, I can also use the point-of-care cart to update Molly's record. This is actually the primary charting mechanism. Alone in her room, Molly realizes that she forgot to mention that she gets nauseated when receiving analgesia and wonders if she can get some Gravol with her pain medication. She pushes her nurse call button to request assistance. The Notification Manager application, in concert with the nurse call system and the unified communications infrastructure, enables Molly to directly communicate with the staff. Her request is communicated to the central nursing station, where a call can be answered or relayed directly to specific staff at the location. Simultaneously, the call request is also sent to Molly's assigned nurse on the nurse's mobile phone through the ThoughtWire Notification Manager application. In this case, the call has been relayed to the mobile phone. The nurse call system, in conjunction with the ThoughtWire Ambient Alert Management, enables workflow optimization starting from an initial patient request through fulfillment. The Ascom and ThoughtWire integrated system enables full reporting on the entire workflow. To optimize the workflow of a nurse responding to a call with a variety of different options allows the nurse to prioritize the calls based on patient needs, organize the requirements of the calls to be prepared when going to see patient, and ultimately spend less time finding resources that are required for the care, and consequently she spends more time with the patient. We initially estimated nurses would walk about 12 kilometers a day, double what they do in the old HRH buildings. We wanted nurses to spend more time with patients, so we needed something to reduce the walk time. Molly lies in a bed providing a secure, dynamic environment capable of pressure-altering surfaces to foster skin integrity, monitoring patient weight, as well as wheels, side rail status, and patient communications, also integrated with the nurse call system. Molly needs to visit the washroom and attempts to go to the washroom on her own. You will recall that Molly has been flagged in the system as a falls risk. Consequently, when she goes to get out of bed, a bed exit alerts to the central station and to a staff phone. The staff are able to respond immediately to prevent Molly from falling.
So I'm going to place an order for blood pressure medication today, and I'm also going to place an order for a repeat blood study.
Here we are in the hospital pharmacy, where we can see how Molly's medications are prepared. Our pharmacy is equipped with a pick pill robot, which creates a rain of Molly's individual meds. Each medication on the rain is unit dosed and barcoded.
It collects the medications that will be put on a pick ring, 1 ring per patient. So it gets dispensed from this machine. The machine actually will package the product, put a barcode on the product, and then it will actually dispense it on a pick ring, which will then be dispensed through the machine. On the first section of it, you'll have your patient information. And then the pick ring, you will have all of the drugs that are scheduled for that patient. It also has a barcode that the nurse used to scan up on the unit prior to administering to the patient. It's 1 pill per package.
The pharmacy technician will pick up the patient-specific pick ring, which has the patient's name, location, as well as the different medications in it, place it into the transfer cart. And this transfer cart is then transferred to the automatic guided vehicles to be delivered to the nursing station.
The automated guided vehicle communicates with doors and elevators and alerts passers-by of its presence. It has been programmed to stay in controlled paths within service zones to minimize conflict. Here we are back at the nursing unit as the robot is arriving with the medications. The pharmacy technician takes out the med drawers from the med cabinet and puts them into the medication cart, which is housed on the nursing unit floor. The technician swaps out the old drawer with the new one and puts the old drawer into the medication cabinet to be returned via the robot to the pharmacy. Each nursing unit also has a drug dispensing unit, or ADU, in its medication room for stock meds that don't need to come from the pharmacy.
This is our automatic dispensing unit. What it uses is fingerprint technology. So at the cabinet, the user would just put in their username, and their password is actually their fingerprint. So they would put it onto the fingerprint scanner. A list of their patients would show up on the screen, and they would select the patient that they're going to remove an item under, and it'll light up as to where the medication is. The nurse would then just open this and remove the medication, and a label actually prints for some of these bulk items, and they would affix it to this inhaler, and then it would be administered to the patient.
The medication room itself is equipped with ID badge scanning in combination with biometric access, ensuring access to drugs only by approved personnel. Also found in the medication room are resuscitation trays that have been prepared in the pharmacy using an RFID kit and tray replenishment checking system.
It scans up to 150 items per second. Once the items have been scanned, it will then identify the product that is missing in the tray, pick our item, put it back into the tray now and replenish the tray, and have the system check the tray to make sure that the tray is ready to go back up to the units to be used.
I am back in Molly's room to deliver her pain medication. I open the drawer labeled with Molly's name and retrieve her meds. I scan Molly's wristband, scan the medication, and verify the match in Meditech with electronic medication record. A notice will be displayed if there is an issue or wrong patient or medication. Here we see the phlebotomist arriving in Molly's room to draw blood samples. As you see, they have a similar cart to the med cart, except the drawers contain vacutainers and sample collection devices instead of medications. The cart also has a printer. We select Molly's blood work order, scan Molly's wristband, and the specimen label is printed immediately, and we then draw the blood. To expedite delivery to the lab, specimens are placed in a carrier and sent via a pneumatic tube system directly to the lab. Here in the lab, the canister of vials is retrieved. The specimens are placed on the lab automation system and processed immediately on the different analyzers. This streamlined process is helping us get to a 1-hour turnaround from order to delivery of results, a process that in the past could take up to 3 hours. Once the testing is completed, the technologist verifies and releases the results. These results can then be accessed by the patient and clinician and viewed on the IBT in the patient's room.
This concludes today's tour of the inpatient room at the Humber River Hospital. We have seen how Molly has been firmly placed at the center of her care experience through the integration and leveraging of a number of digital systems. Please pick up a tour guide and visit the vendors who have worked together to make Humber River Hospital the front runner of intelligent hospitals in North America today.